Good Samaritans still exist, and hope is still alive for the improvement and development of healthcare in St. Vincent and the Grenadines. This, as two Vincentians living abroad, Ms. Suzette Williams and Mrs. Catherine Williams, along with one local partner, Mr. William Harry, came together to garner support from MedWish in the United States and organized to have medical equipment and supplies donated to the Ministry of Health, Wellness and the Environment. The group is an offspring of the Caribbean Diabetes Initiative, Inc., and made it their duties to procure and distribute the medical supplies to the Diabetes and Hypertension Association, the Milton Katie Memorial Hospital, and community clinics here in St. Vincent and the Grenadines. The donation is valued at some EC $30,000 and was handed over in a brief ceremony at the nurses' hostel. Some of the items include insulin syringes and needles, gloves, gauze sponges, pedometers, stethoscopes, blood glucose test kits and strips, and a number of other medical supplies. Here are highlights from the occasion.
And we have a very interesting situation where some Vincentians have taken it upon themselves to take the initiative to give back. Now we have two of them living in the States where they got donation, or they received donation from Medicare, and they have decided to, through their local coordinator, to give back to the Vincentian Society. So as a result of that, our hospital will benefit from this donation. Our Diabetic Association will benefit from this, as well as the clinics across St. Vincent and the Grenadines. Now we're always trying to highlight the positive things that are happening, and so we just want to say a heartfelt thank you to these persons who have not yet even formed a name. They just know that it is important for them to give back. So Sister King is here to receive it on behalf of the Ministry of Health, Wellness and the Environment and the Diabetes Association. And we will have Suzette. She will tell us a little bit about this creative initiative.
So I'm Suzette Williams, and I'm a native-born Vincentian. Haven't been back for a long time, but I volunteer with a group called CDI, Caribbean Diabetes Initiative. And what they do is they go around the Caribbean islands and do teaching and treatment for people living with diabetes. So we planned a trip earlier that didn't quite work out, so two members of CDI took it upon themselves. So that one of the members is myself and the other one is Catherine Williams. We looked to MedWish organization, and they were generous enough to donate wound care, vital sign monitors, Foley catheters, things that we know that are going to help the people of St. Vincent. Things that we know are going to benefit the people of St. Vincent, and it is our pleasure to work with Mr. Harry, who is our liaison in St. Vincent, to get these things donated to the hospital, to the clinics, and to the Hypertension and Diabetes Association. We hope to do this on an annual basis, and we hope what we give will be used a long way.
Okay, we will now hear from Sister King, who will be receiving the items on behalf of the Ministry of Health, Wellness and Environment, and on behalf of the Diabetes Association.
Good morning. It's a pleasure being here this morning, and small favors have been given to us in St. Vincent and the Grenadines on behalf of the Ministry of Health, Wellness and Environment. I thank Catherine and her group for giving us these medical supplies. This will go a very long way in us to providing our best quality care to our patients. And also for the National St. Vincent and the Grenadines Diabetes and Hypertension Association, we know that the things that they have given us has also benefited us this week in regards to World Diabetes Day. We had a symposium, and the information that we shared with the persons who take part in the workshop. So these small tokens have gone a long way already, and we wish that, as she said, they will continue for the rest each year annually to share with us. And as I said, on behalf of the Ministry of Health, Minister of Health, the PS and all the senior members, we wish them all the best and success, and we thank them for giving us this reward so we can give service to our persons and our community of St. Vincent and the Grenadines. Thank you.
now have the official handing over where we will ask Sister King to receive some items.
Well, on behalf of the Diabetes and Hypertensive Association, we would like to thank Suzette and her team, our past Commissioner Harry. He is very passionate, like myself, about diabetes and taking care of our diabetics in St. Vincent and the Grenadines. And we are always chatting about what more we can do to assist our patients here. So this morning is a real pleasure for us to accept these gifts to ensure that we work better with our diabetics in St. Vincent and the Grenadines. Thank you very much.
We also just want to say that we appreciate the fact that even though Susan and her team Suzette and her team came specifically to deal with diabetes, they have extended their gift towards the hospital and the nurses. So they're saying that even though their focus is in one specific area, they have gone beyond those borders and territories to ensure that all Vincentians in need of medical care benefit. And we want to encourage persons out there who may have any links or any association to groups or organizations who are willing to give in any area that can benefit the people of this nation, that it is welcomed and it is well received. Thank you so much, and we truly appreciate it. And this thing is so special because you guys have just decided to do that for your initiative. You have not even given yourself a name as yet. And the funny thing, the funny thing about it is that they're so humble, both of them trying to hide in the background, trying to push the other forward, not being really, everybody just wants to stay away, but we really want to give credit and give thanks for the initiative, for the will to want to see and do better for your people, for the will to want to see and do positive changes in the lives of Vincentians here. And we thank you so very much for that.